Every year, we celebrate World Cancer Day to raise awareness and take action towards prevention, early detection, and treatment. The more we know about the disease, the more lives are saved. For instance, more than 30% of common cancers are preventable. Also, early detection helps improve the chances of a treatment success. I'm Dr. Freddy Gomez. Join us in finding out how this challenging disease affects us and how we can work towards a cancer-free world for all. This is MedTalk Health Talk on CNN Philippines, where we bring you the knowledge and care you need, especially in this time of COVID-19. Treatment and management for cancer have advanced over the past few decades, saving countless of lives. To talk about this topic more, let's welcome Dr. Aldin Astrid Basa. She's a breast surgeon at the Asian Hospital and Medical Center. Also joining us is Dr. Dave Cebollena. He's a gastroenterologist from the University of Perpetual Health Medical Center, Las Piñas, and De La Salle University Medical Center. Cancer is the third leading cause of death in the Philippines. Some of the most common cancers that affect Filipinos are breast, lung, colon, liver, and cervical cancer. Now, most people in low and middle income countries like the Philippines pay for health care out of their own pockets. Now, I'll start the discussion with Dr. Aldin. Is the government really active in giving financial support to those of our less fortunate brothers and sisters who have cancer?
Yes, actually, the government has passed the NICA law, the National Integrated Cancer Control Act, which was already approved, but they're still in the stages of creating the implementing rules and regulations. But hopefully this law will create cancer centers all over the country where people could consult and have their screening and treatment, and hopefully for free, because you know that breast cancer is the number one cancer in the Philippines, and it's, killing many women daily. And one of the programs existing right now is the DOH has this breast cancer medicines access program, where patients who cannot afford chemotherapy and all the drugs that they need can get it from the DOH.
People living with cancer often benefit from the advice they get from others who have lived through similar situations. Dr. Aldin, are there any support groups here in the country for cancer patients?
Cancer support groups have become really an essential part of a breast cancer patient's journey to healing. The support that women get from somebody who has been through the same thing is essential for them, for their being able to handle the stress and all the challenges that come with the journey. Actually, a lot of hospitals have cancer support groups. And then there's a big cancer support group called I Can Serve, which apart from advocating for women with breast cancer, they also have support group services. And women have really taken to this because the support that they get has really been a big help for them.
Now, since we're still in a pandemic, people with cancer are at a higher risk of developing serious illness from COVID-19. If a person with cancer contracts the virus, it could open them up to other medical complications that will affect their already weakened immune system. Dr. Dave, is the COVID-19 vaccine safe for those with cancer, for cancer patients?
Yes, the DOH set up the guidelines that COVID-19 vaccination is essential and needed, and vaccinated patients prevents severe forms of COVID, and it lessens the risk of mortality.
For those who are unsure on the timing on their vaccine, can they get the vaccine during cancer treatment or should they wait after? What's the usual protocol for this?
There is really no definite timing for cancer patients. What the patients with cancer do is consult their attending physician and ask with regards COVID-19 vaccination.
Chemotherapy, radiation therapy, even surgery are really essential, especially when someone is diagnosed with cancer. Are these procedures still safe to do amidst the pandemic?
Yes, it is very important for cancer patients to continue their treatment, especially at this time of a pandemic. The Philippine Society of Medical Oncologists on the early part of the pandemic has released a guidelines on cancer treatment. So it is imperative that all cancer patients especially those that are symptomatic in the early stages of disease, and those with locally invasive cases continue their treatment.
Dr. Alden, you mentioned earlier how breast cancer is the #1 cancer here in the Philippines. Is this a new trend? Has this been going on for quite some time?
Because it's actually the most common cancer affecting women worldwide. And we have a very large population. We're more than 100 million. So it's expected that we should have a lot of cases here. But what's more alarming than the incidence is that our survival rates are not good, because a lot of women don't consult early. And this is where early detection is really so important. And it's something that really needs to be addressed, because we should have, even if we have a higher prevalence rate, we should actually try and do something to decrease the mortality. And this is what the NICA law is trying to address, so that we're able to screen for breast cancer and detect it early and have more women surviving it.
A follow-up question to that, Dr. Alden, is breast cancer highly preventable?
No, you cannot prevent it. All we can do, unless of course you have your breasts removed, that's the only way you can prevent it. But we can detect it early. So there's no way that you can prevent it, because we don't really know what causes breast cancer. We can't say that if you eat a certain diet or you have a certain lifestyle, it'll prevent breast cancer. It doesn't. The only thing we can do is detect it early.
When we return, we'll go in depth on the most common cancers that affect Filipinos. We're your connection to healthcare. You're watching MedTalk Health Talk. Did you know that around 200 out of every 100,000 Filipinos are diagnosed with cancer? I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk. We're together in health. The Philippines has the highest prevalence of breast cancer here in Asia and the 9th highest in the world. Now, Dr. Basa, we've been discussing about how prevalent breast cancer here is in the Philippines, but what is the best way? How can our viewers be able to detect this early?
And the way we detect it is all women should have a mammogram and ultrasound yearly starting at 40 years old, whether you have symptoms or not. Because it is only through the mammogram and ultrasound that we are able to see a cancer even before you can feel it, or even before you have any symptoms. And this is how we detect it early. So annual mammogram and ultrasound is essential.
And one thing that a person can do is to regularly examine themselves on their own. How important is it for our viewers to be able to know how to spot early symptoms of breast cancer?
Examining your breasts monthly is not going to help you detect cancer early. Okay? It is not a substitute for doing your mammograms and ultrasound yearly. But it is important. This is actually part of the screening triad. You should be examining your breasts monthly and having your mammograms and ultrasound yearly starting at 40 years old. And the reason why we advocate for self-breast exam, even if it's not a substitute, is because it helps. Actually, majority of women who found a lump, actually, they were the ones who felt it. It's not like they went to the doctor and the doctor was the one who felt it. It was the patient herself who felt it. So it's important that women are familiar with how their breast feels and are able to detect a change if something happens.
Okay. Can men have breast cancer as well?
Oh yes, men can have breast cancer, but it is rare.
Yes.
Only 1% of males can get breast cancer, but they can.
That is why it is important for both men and women to know the signs. Now, Dr. Alden, what are some of the signs and symptoms one should look out for?
If you feel a lump, not all lumps are breast cancer. 80% of lumps are benign, but the moment you feel something, you should consult a doctor. It is supposed to be us who will decide what kind of lump that is, but don't think immediately that is cancer. If you detect a change, like for example, there's thickening in a part of your breast, then that's something that's not normal, or there's dimpling, or all of a sudden your nipple retracts and it wasn't like that before, that's something alarming, so you should see a doctor. Generally, it's very hard to teach somebody how a cancer feels like, or how something suspicious feels like. So the advice is If you see something that changes, that wasn't there before, any change, you should see a doctor.
Colon cancer is another type of cancer that is common among Filipinos. It typically affects older adults, but it can happen at any age. Now, many people with colon cancer experience no symptoms at the early stages. Dr. Dave, this is what's really frustrating about colon cancer, because when it's at that stage where we want to catch it, there are no symptoms. So if there are symptoms and they do appear at a later stage, what are they kaya, Dr. Dave, yung mga simptomas na nararamdaman ng tao?
The symptoms are usually changes in bowel habits. No? This can be constipation, diarrhea, or both. Another important symptom is presence of bloody stools or bleeding per rectum, decreased caliber of stools, sensation of incomplete defecation, weight loss, poor appetite, weakness, and abdominal pain. Most patients with early stage colon cancer are asymptomatic. And because of this, colon cancer remains the third most common cause of cancer for both males and females, and the third most common cause of cancer mortality in our country.
At what age should people be able to do their colon cancer screening tests?
Okay, for asymptomatic patients at age 50, a FIT test is currently recommended. For symptomatic patients, from the symptoms that I mentioned previously, some of them might need to undergo an imaging test such as proctosigmoidoscopy and or colonoscopy.
But liver cancer naman is common in the country because many Filipinos suffer from cirrhosis of the liver, which is a major risk factor. Now, cirrhosis is a late-stage injury or scarring of the liver caused by many forms of diseases and conditions such as maybe hepatitis or alcoholism. Now, one of the ways to prevent liver cancer is to reduce your risk of cirrhosis by limiting your alcohol intake. Dr. Dave, aside from these, what can we do to prevent this type of cancer, hepatic cancer, liver cancer?
Okay, in our setting, majority of patients who have liver cirrhosis is due to a chronic hepatitis B infection. So with that, it is very vital that patients be vaccinated against hepatitis B.
With colon cancer, we have colon screening tests for that. Paano naman, Dr. Dave, for the liver? Will liver cancer screening help reduce someone's risk for liver cancer?
Liver cancer screening would help detect and prevent early cancers of the liver. So presently, a CPG was recently published by the Hepatology Society of the Philippines. And the recommendation is a semi-annual ultrasound of the liver for patients at risk for cirrhosis and hepatocellular carcinoma.
Now, early detection is vital to a successful treatment. More on this when we return. Your health is our mission. This is Med Talk Health Talk. Cancer treatment is done to cure, shrink, maybe stop the progression of a cancer or slow it down to make the patient more comfortable. I'm Dr. Freddy Gomez, and you're watching Med Talk Health Talk, where your care always comes first. The goal of cancer treatment is to achieve a cure for your cancer, allowing you to obtain better quality of life. Sometimes, though, a cure is not possible, and treatment may be used to shrink or slow the progression of cancer to allow you to live symptom-free for as long as possible. Dr. Aldin, how comparable is the Philippines in cancer treatment compared to more industrialized countries?
Actually, we are at par with the global standards of care here. Everything that is being given in a first world country, we have here. It's available, from all the options for surgery up to the chemotherapy drugs and radiotherapy treatments afterwards. It's all here. So really, Filipino patients do not need to go abroad for further treatment.
Now, chemotherapy works by stopping or slowing the growth of cancer cells. Surgery plays an important role as well. Dr. Alden, what can one expect when receiving this type of treatment? Is chemotherapy just as important as the surgery that sometimes it may entail, depending on that cancer? In this situation, breast cancer.
Oh, definitely. For breast cancer, all treatments are essential to your survival. So the first step, once you get diagnosed after a biopsy, is to have surgery. That's the usual sequence of treatment. You have surgery so that you can remove the cancer from your body. After that, depending on the results from the surgery, because we biopsy the breast or whatever we removed and the lymph nodes, and we check everything, we do tests to find out if the cancer is aggressive. And based on those tests, we determine if you will need chemotherapy.
Now, ultrasound and a mammogram by themselves are very powerful tools, but combined, they are vital in being able to screen and detect possible breast tumors. Dr. Basa, tell us more about this, the importance of the ultrasound as well as the mammogram.
All right, so the mammogram is like an X-ray of the breast. What we look for in mammogram are microcalcifications. These are like calcium deposits that are in the breast. We have this normally, but there are certain configurations that are very suspicious for cancer. And if this is seen, is actually the very first sign of cancer. This is where we can detect it at stage 0. When it is pre-cancerous, it's not yet cancer. Now, in ultrasound, what ultrasound sees is if you have a lump already. So if you have a lump, the ultrasound can determine whether it looks cancerous, it looks malignant, or it looks benign. But a lump already exists. With a mammogram, you don't have to have a lump yet. Just calcifications, it can pick it up.
I would like to ask Dr. Dave, it's a little bit controversial, but is there a role for herbal medicines in cancer prevention, cancer treatment?
There is no role for herbal medications or any dietary supplements. Numerous studies and meta-analysis will support this.
At the end of the day, all of us are stewards of our own health. So understanding the limitations of herbal medications is vital. So talk to your doctor, talk to your gastroenterologist with regards to the type of medications and how these may affect you in the long run. Because how we live affects our health and our wellness. And this also applies to people living with cancer. Now, making positive lifestyle changes can greatly improve your cancer treatment. Dr. Dave, let's talk about kung ano mga changes ang pwedeng gawin ng mga tao, especially those who are diagnosed with cancer.
We usually advise patients, I know it's a very difficult time for them and their families, but it is advised to live normally, and of course, healthily as possible. For me, I personally believe and always advise my patient to have some form of mild to moderate physical activity. And with that, I always advise my patients to have short walks in the morning and in the afternoon and be very conscious of their food choices.
How important is getting support for cancer patients? How important is it, Dr. Dave, na the cancer patient doesn't feel like na they're doing this all by themselves?
Okay. In our setting, Dr. Freddy, we are very fortunate that yung support system natin, support system of our patients, sobra siyang extended, from the family members, extended family members, friends, and even friends of friends. We're very fortunate that malasakit, is still very pervasive in our country.
This discussion was indeed very helpful for a lot of people. Thank you, breast surgeon Dr. Alden Astrid Basa and gastroenterologist Dr. Dave Saboliana, for sharing your expertise, especially this very important day. Now, the cure for cancer may still be elusive, but early detection and a healthy lifestyle can greatly help with successful treatment. Remember, cancer is just a chapter in our lives and not the whole story. I'm Dr. Freddy Gomez, and we want to be your partner for a lifetime of good health. This is MedTalk Health Talk. Stay safe, everyone.